Good afternoon, everyone. Today, we are going to talk about application of wastewater-based epidemiology in Suffolk County, New York, surveillance of SARS-CoV-2 antiviral drugs, and more. Working. So wastewater-based epidemiology, also called wastewater surveillance, can provide information on the risk factors and health status of a population through analysis of their wastewater. It has previously been used to track the infectious disease like polio in the 1990s. The method is not novel or restricted solely to the detection of SARS-CoV-2, and is also adopted to monitor illicit drug use, antibiotic resistance, and other waterborne pathogens. Because wastewater surveillance of SARS-CoV-2 is an unbiased and non-invasive population health assessment tool, it's now used globally to monitor SARS-CoV-2 in at least 37 countries, and over 200 organizations announced that they are using this method to track on the SARS-CoV-2 from over 3,000 sites, including wastewater treatment plants, sewer catchments, and the surface water. In April 2020, we had our first effort to sample from Riverhead STP to build up our protocols for monitoring SARS-CoV-2 in wastewater. SARS-CoV-2 viruses were successfully detected in the wastewater samples, and we saw a decay of the concentration, which paralleled with the decay of caseloads. During fall 2020, we started a mini wastewater surveillance project at Stony Brook University, where we began tracking the SARS-CoV-2 in the affluents of dorms on campus. These two figures shows the caseloads on campus and also the SARS-CoV-2 concentration in the dorm affluents at the same period of time. SARS-CoV-2 were detected in the affluents, and the results showed some early signs before the case number increased. The red figure shows the COVID-19 positive cases in Suffolk County from 2020 to 2022. After the first wave, which started from March 2020, we took immediate actions to sample raw wastewater samples from Bergen Point SCP, which is the largest SCP in Suffolk County. After that, in April 2021, we continued our project to sample wastewater from Selden SCP. In February and May 2020, we expanded our sampling size to include Port Jefferson and Riverhead STPs. Currently, we are measuring wastewater samples from these 4 STPs on a weekly basis. So in our wastewater surveillance project, we collected untreated wastewater from pump stations of these 4 STPs, and we collected the samples 2 or 3 times on a weekly from each site, because this can provide actionable and timely data regarding the changes in COVID-19 transmission. 24-hour composite samples are collected by the composite auto-samplers. This type of samples are less likely to produce false negative results for the measurement. After sampling, samples are analyzed in 4 steps. The first is sample preparation. For optimal results, samples are processed within 24 hours by using centrifugation to remove large solids. Then we use a PEG precipitation method to concentrate the RNA from the wastewater samples. RNA is extracted by a commercial extraction kit, which can provide a highly purified RNA for our next steps. And that is the RNA measurement. So polymerase chain reaction-based quantification is the most common method for wastewater surveillance of SARS-CoV-2. In our project, we use the RT digital PCR, which is the third generation of PCR to detect and quantify the SARS-CoV-2 in wastewater. Instead of using one reaction tube for a single sample in the traditional RT-PCR, digital PCR uses a chip with 20,000 reaction wells in which we are reacting the samples with the primers and probe. More reaction wells means more data points and more accurate data at the end of the applications. And unlike traditional RT-PCR, digital PCR doesn't depend on standard curves to quantify the RNA, and also is more tolerant to the inhibitors in the wastewater. Here is the wastewater data we obtained from June 2020 to this end of May from Bergen Point STP. The orange line represents the SARS-CoV-2 RNA concentration in wastewater, and the blue bars represent the COVID-19 positive cases number in Suffolk County. As you can see that there are about 4 waves during this period of time, and the samples are consistently positive for SARS-CoV-2. The case numbers lagged behind the wastewater data by several days. Therefore, the wastewater data can help us detect the transition of COVID-19 even before the data from the hospitals. It enables early detections of the outbreaks. Here are other wastewater data from Selden STP, Port Jefferson STP, and the Riverhead STP. Generally, similar trends and conclusions can be found from Selden STP, and we also found different concentrations of SARS-CoV-2 in different parts of our communities. More data over time needs to be studied, as it can provide better and more reliable trends for health departments to understand the local COVID-19 situation. Our work is in collaboration with Suffolk County Department of Health Service, New York State Department of Health, and the CDC. Our testing data, along with the associated utility metadata, are submitted to them every week. Here is an example of the New York State wastewater surveillance systems. Our next speaker, Daniel Wang, will talk more about the system. So basically, we can use this system as guidance to check up our local COVID-19 situation. So currently, the levels of COVID-19 transmission are still pretty high in Suffolk County. So I recommend that we still need to pay more attention to the COVID. And now I'll pass you over to my colleague, Dr. Cheng-Shiuan, for more wastewater surveillance project conducted in the center.
Okay, thank you, Mian. So, not very clear. Okay. So, in addition to the virus, so we also monitor other chemicals or biomarkers such as antiviral drugs and common pharmaceuticals in the wastewater samples we collected. So the major reason is to complement and strengthen the RNA-based virus detection method for this wastewater-based epidemiology. And it could also allow us to understand the impact of the pandemic on pharmaceutical consumption. So in this table, you can see we monitor like 3 antiviral drugs: chloroquine, hydroxychloroquine, and remdesivir, and 2 of their metabolites. And those 3 antiviral drugs, they were authorized by the FDA in like early 2020. And although the EUA of the first 2 compounds, they were revoked afterward, but some hospitals were still using them for treating patients in this period. Okay, so here's a list of like 26 other pharmaceuticals we monitor in wastewater. So including the prescription and over-the-counter drugs, and also you can see some stimulants like caffeine and nicotine. Okay, so for this project, we developed an analytical method using the isotope dilution and solid phase extraction techniques to concentrate them from wastewater, and the measurement was done by a liquid chromatography tandem mass spec. So we are able to detect these chemicals in wastewater at the parts per trillion level. Okay, now let's take a look at some data. So here's the time series data for the raw concentrations. So the top two panels here, you can see which is the virus concentration and the confirmed cases over time, just for comparison. And below you can see the concentration of these antiviral drugs over time. And overall, the trend wasn't very clean compared to the virus concentration and the confirmed cases. So one possibility is some of these compounds, they were not very stable in wastewater. For example, like remdesivir. So this one can degrade rapidly in wastewater within like 24 hours. So that's why you see a lot of like non-detectable samples. And also some compounds like hydroxychloroquine, so it is used for like treating like multiple diseases. It's not exclusive for COVID. Yeah, so the only like a similar trend we observe is this one, the hydroxychloroquine, which is a metabolite of hydroxychloroquine. So you can see we see a peak in late November 2020 and a peak in December 2021. Yeah, but we need like more like data analysis to confirm this trend. Okay, and we also have data, time series data for other 12 detected pharmaceuticals. And as you can see, they all have different trends. So in order to understand the stories behind these graphs, so we need to do like more in-depth like time series data analysis. Okay, so we're working on it right now. So there's a lot of data here. And okay, so among all these chemicals, so one chemical like acetaminophen, this one showed the very similar pattern compared to the virus concentration and case numbers. And you can see these two peaks like matched pretty well, like one peak in the late 2020s, probably alpha, and of course, and then the Omicron surge in late 2021. So we know during the incubation period of COVID-19, so infected people, they can show symptoms like high fever, headache, and cough. And these symptoms can often lead to like self-medication, requiring like over-the-counter drugs such as acetaminophen. So that means, so acetaminophen can be a good biomarkers to like complement our viral data. Okay, and okay, so the more statistic here. Okay, so here we did like a simple like pairwise like a correlation between all the variables we measured. So if you see like a bigger, like a darker like a blue circle, that means a stronger positive correlation between two variables. And here you can see, we see a very strong positive correlation between virus concentrations and confirmed cases, which it should be. And we also see like very good positive correlations between like acetaminophen like versus virus and cases, which is like validating the trend like you saw in the previous slide. And for the correlation between the desethyl hydroxychloroquine versus virus, and it shows like a slightly like a positive correlation here. And yeah, and again, so and we're trying to we have a lot of data, and we're in progress trying to use like all kinds of different like data analysis approaches to find out like any like correlation or trends among these variables. Okay, so beyond this COVID-19 wastewater-based epidemiology, so the next step, so the center is going to involve a new project about like opioids. So we know the New York State is planning to expand the wastewater-based epidemiology applications to include other biomarkers, such as like antibiotic resistance, OPS, and influenza. And especially, I just want to focus on the OPS right here because we know the OPS crisis is emerging in the US nationwide. And our lab is actually developing a standardized analytical protocol for OPS to help with a statewide OPS surveillance program. And okay, so the next slide. So we have already established an analytical method in-house. And here's an example that we can identify and quantify all these OPS. So here you can see, like OxyContin and fentanyl. These two commonly seen like abuse opioids in the US. And we're almost like complete this protocol, and we anticipate starting this project soon this year. Okay. And at last, I just want to emphasize that wastewater-based epidemiology is a relatively young and like a fast-growing field, and people, have been making like a new advancement continuously every year. It has a lot of potential, and new biomarkers and improved like new analytical techniques can always offer like new insights into a new area that wastewater-based epidemiology could be applied in future. Okay, so lastly, I just want to thank everyone in the center, and also I want to thank the government agencies and the local wastewater treatment plants for their support. Thank you.